for joining us today. First off, I wanted to just make the announcement that this session will be recorded, so we can provide you with that recorded link after the meeting. We do ask that you please just mute yourself and use the chat box as we go through as questions come up. Once we go through all of the information, we'll open it up to review those questions and any other discussions that we are in other points that we need to address as we go through this. So thank you very much. And I'm looking at our participants. So we have folks that will be joining us or should be already on from Centro Multicultural La Familia, Honor Community Health, St. Joe's, Oakland County Health Division, Gary Bernstein Community Health Clinic, Oakland Livingston Human Service Agency, Sheriff Powell, Oakland University, and Oakland County Neighborhood and Development. And so a lot of great partners on this morning. So thank you so much for your time. And again, for those that are just joining, the session will be recorded. Please keep yourself on mute, and then you can use the chat box to put any questions in, and we will get to those questions after we go through all of our information. And so, all right, Rita, you want to take us off? Rita will be sharing her screen here as we go through this presentation. All right. So this is just popping up here. Can you all see it yet? Okay. All right. So prescription for a healthy Oakland. This has been a long time coming, and so we want to thank all of our partners as well for your patience as we've gone through this pandemic and done revisions. And so now we're really getting back to that original intent of the project. And our vision for this project overall is to empower residents in the greater Pontiac area to achieve healthy lifestyles through community engagement. And we have 4 major program goals for this. And my apologies, my internet's a little lagging. Those goals include to increase participants' knowledge and skills to engage in healthy behaviors, to increase fruit and vegetable consumption and time spent doing physical activities, to promote relationship building among our participants and our community, and to foster these partnerships with local clinics and healthcare providers, our food markets, our vendor sites, our gyms, other physical activity sites, to really promote health improvement and sustainability. And this program is built on that model of social prescribing. And so I just wanted to briefly highlight what the model looks like in its foundational form, though we've certainly expanded this to include community members and partnerships with our social and human service agencies. And so the idea behind social prescribing is that an individual with complex needs or any needs, and in our case, needs around fruits and vegetables and physical activity, would visit their primary care physician or a social or human service agency in our case. Then that individual will be prescribed resources in the community to meet their needs. And then through this prescription, the person is connected with different support, whether it's physical support, mental, emotional support, or spiritual support. And again, in our case, we're looking at support around access to fruits and vegetables, physical activity, and other community engagement resources. And so your involvement in this program is really key here because you're upholding this model and also fostering this model. And so we're really looking for, lots of engagement between our partners, their clients and us to promote that model. You want to go ahead, Rita, here? And so I wanted to just give you a little introduction about that program, and then I'm going to pass it off to Rita, who will be talking about the nuts and bolts of the program.
Sure, thanks so much, Laurel. So continuing on, I know that one-on-one we've had these conversations, but I just wanted to go over in depth again what we're kind of looking for when we are bringing clients into this program. So eligibility for this program is people who are considered low income. That is a very loose description. We will not be checking people's incomes, asking for any proof of income. If someone feels like they need this assistance, we will provide it to them. Families with at least one child under 18 and adults age 60 and older are a target demographic. They have identified a need to fruits and vegetables. You will hear us say fresh fruits and vegetables a lot, but they actually can purchase frozen as well with their vouchers, and must be able to shop at participating vendor locations. And what we mean by that is that the target area for this program is Pontiac, Waterford, and Auburn Hills. However, if there's somebody who lives in Rochester or Bloomfield or Lake Orion who is close to the area and identifies a need, we will not exclude them from the program. They just have to have the understanding that all of the vendor locations as of now are in Pontiac, and we're hoping to sign up some vendors in Waterford as well. So quick program overview. We are hoping to enroll 400 program participants starting April 1st through November 2021. So we are going to be prepared to accept clients starting April 1st. However, I will express that this is a soft launch. We want to start slow in April. So we are asking that you as referral partners, it is okay to start sending us people but to not like send us 100 people all at one time. Kind of start slow, and then we'll pick up more in May, and we'll be able to accept participants starting all the way through November. So each client will receive produce prescriptions based off of the social prescribing model that Laurel reviewed. They can be spent on produce at participating vendors. Families will receive $80 a month for a period of 6 months, and seniors will receive $40 a month. In a part of participation in our program, they will have to participate in virtual health education sessions. These are going to be 15 to 20-minute videos that they'll have to watch. It'll be followed by some short questions, between 3 or 5 questions. And it also provides a space for reflections if they have questions or thoughts on the video that they want to go over with one of our program specialists. They can put that information in there as well. We'll also have physical activity resources that will come by way of physical activity challenges. We have things like physical activity bingo. And if you complete bingo and you provide us with some photos, you'll be entered into a raffle to win things that we're gonna provide that can help enhance a healthy lifestyle. For instance, we've had some gym memberships donated to us. We'll purchase a few grocery card gift cards for grocery stores, or even give away household appliances that can help facilitate a healthy diet, like air fryers, blenders, those sorts of things. And there's also going to be web-based activities and community resources. We will have a different exercise video posted weekly. We'll let them know if there are things going on in the community that they can participate in by way of physical activity. So participating vendors. So we are still working very hard to solidify vendor contracts. These are the ones that we anticipate having complete by the end of April. So again, that's why we are trying to do a soft launch, because as we enroll people, we want to make sure that they have some place to shop. And these contracts are still being finished. We anticipate them to be done by the end of April. So we want to be able to send out vouchers when people have some options of places to shop. So the health education topics, again, there are 5 health education sessions, and there's also an enrollment video that counts for month 1. the topics that we'll be covering are goal setting and time management, shopping on a budget, healthy lifestyle, meal planning and pantry management, and advocating for your health. Referral partners that are represented here on this call, we are so grateful to have you participating in this program and excited for what that means to the program. And these are the people that Laurel reviewed earlier. The information that's important to you all right now is this last line that says target enrollment for each site is 75. So seniors and families combined. So we are hoping that each of you can provide us over the course of the program with at least 75 client participants. This is also a soft number. What we're going to do is just see how enrollment goes. In about 3 months in, we're going to just check and see where are we at now. How many people have we have come into the program? How many people have dropped out? How many people are we still serving? How much money do we still have? And if we can make changes to your target numbers at that time, we'll reach out to everyone and just let them know, like, hey, you're referring a lot of people, so keep that up. We can take this many from you. Or if there's not as many, we can have a conversation about that as well. So the enrollment process. And this is the part of the process that really we're here to discuss with you all. So we have this, what we consider like gold standard of enrollment. So if enrollment was to go perfect with every single client participant that you refer to the program, this is what it would look like. And this is a lot of words on the screen, but I'm going to take you step by step in what we would like it to ideally look like. So with the client present in the office, ideally, this is something that would be able to happen completely before they leave your referral site. And the concern there is if they're just given an info card, they'll just see it and be like, oh, toss it to the side and forget it. And we also want to establish that social connection between the referral site and the client to say, this is something that I believe would be helpful to you, and get them actually enrolled in what we have going on. So the client and clinic staff can go to our website and help the client with the enrollment process. There's a 7-minute enrollment video that they would have to watch. And there is a brief quiz on the enrollment video to make sure that they understand what they're signing up for. And the reason for that is we want to try to mitigate as much dropout as possible. So when watching the video, we want them to have a full understanding of what they're participating in, instead of going home and then saying next month, oh, I forgot about this. I didn't know that I was participating in this. So there's an enrollment form that they will need to complete first. We would like for them to then watch the video and then complete a pre-program survey. So let me just take a moment to walk you through what that will actually look like. I'm going to take you to our website. Our website is live. So I'm going to click on it here through the program, but you're welcome to go browse it and look it over and just see what we have available afterwards to explore the whole site. Can you guys still see the website stuff here? Okay, awesome. So this is the landing page for our site. And if you are enrolling a participant, you would come here first with the client with you. You would go here to our enrollment screen. And so it just takes you through it step by step. I am going to show you guys the enrollment video so you know exactly what they'll be watching. So first you would click here to the enrollment form. So we talk about the gold standard. We would like for this all to be completed at once, but if it's a busy day or this is something that is challenging for your clinic, please let us know. We can have those conversations one-on-one so that we can build a process that works best for your site. But at the bare minimum, we need the enrollment form completed, because if the enrollment form is completed, we can then follow up with the clients and make sure that they get the rest of the information that we need for them to be successful in the program. So we can go through this really quickly. I'm just going to click through. The enrollment form, as you can see, is not very long. Just filling out basic information. There are 2 consents to be completed. So if they're completing it with you in the office, we just want to make sure that you go over the This is just a standard photo release, and have them type their name and the date, and then a standard liability release as well, and that's the enrollment form. So again, that's the bare minimum on a busy day or whatever. That's the bare we needed completed, and then after that is completed, about that, we can go back here to the site. And this is our enrollment video. So I'm going to go ahead and show the video so you'll know exactly what they'll be watching. If you don't hear any sound, please let me know. Is there sound?
Awesome. Hello, and welcome to the Prescription for a Healthy Oakland program. Whether you were referred here or decided to join on your own, I just want to congratulate you on taking this next step in your health and wellness journey. This enrollment video will provide you with some information about the program, some of the program expectations, and direction on how to use your produce vouchers. First, I'd like to share our vision statement with you. Our vision is to empower residents in the greater Pontiac area to achieve healthy lifestyles through community engagement. Now, I'd like to take a moment to go over some of the Prescription for Health program goals and expectations. This 6-month program will consist of a variety of ways to engage you in healthy living and healthy behaviors. The main goals of the program are to increase your fruit and vegetable consumption and your time spent doing physical activity. Increase your knowledge and skills to engage in healthy behaviors. Promote community and relationship building. Build upon and raise awareness of resources that are available in the community. Additionally, we are making some commitments to you in this program, and we'd like to ask you to make some as well. Together in our partnership, we will identify and set attainable goals. Identify the obstacles or barriers to obtaining your goals. Find the healthy and safe solutions to the obstacles. Find reasons to believe in yourself and your ability to succeed. Celebrate your efforts along the way. As your health team, we will maintain your confidentiality, be as excited and committed as you in achieving your goals, provide support and structure to help you remain focused in achieving your goals, encourage, support, and empower you to adopt healthier lifestyle habits, hold you accountable to help you reach your greatest potential, provide you with health information on healthy eating, getting active, and managing stress, provide resources for you to increase your physical activity and fruit and vegetable intake, provide resources to help you feel socially connected and decrease stress. As our clients, we ask that you complete all required components of the program. Be fully prepared and focused while completing your health education session. Engage in goal setting and attainment with the health team. Be willing to make changes to achieve your goals. We are looking forward to making this a rewarding and life-changing experience towards improved health for you. Next, I'd like to go over some of the things you will need to know about the program itself. First, the Prescription for Health website is where you will find almost everything you need to be successful. The website will have all of the health education sessions, physical activity challenges, community events, and any other resources that will be helpful to you. It also has our contact information so that you can reach us should you have any questions. Moving on. Participants receive a prescription to purchase fruits and vegetables. Vouchers will be sent to you after you complete your health education session and will always expire on the 15th of the following month. Families will receive $80 worth of produce vouchers per month, while seniors will receive $40 worth of produce vouchers per month. The health education sessions range between 10 and 20 minutes and end with a quiz and reflection. The entire session, quiz, and reflection must be completed by the 15th of each month in order for you to receive your produce vouchers. However, the sooner you complete them, the sooner you will receive your vouchers. Occasionally, You will receive a goal check-in call from one of our program specialists, as we like to touch base to ensure that you are keeping up with your goals or to see if there's anything that we can do to assist you along the way. Lastly, keep an eye out on our website for physical activity challenges and scavenger hunts so that you don't miss being entered into regular prize drawings for small kitchen appliances like blenders and air fryers, among other things. Who doesn't love prizes? There are several different locations that you will be able to use your produce vouchers, including grocery stores and farmers markets. For a comprehensive list, go to our website. We will continually be adding to this list, so also be sure to check back frequently. You can only purchase approved items with your vouchers. These items are fresh fruits and vegetables, pre-cut fruits and vegetables, frozen fruits and vegetables, bagged fruits and vegetables, and fresh herbs and seedlings. An example of a seedling is a small starter plant that you can use to grow vegetables in your own garden, like a tomato plant. One important thing to keep in mind is that these produce vouchers do not cover fruits and vegetables that are combined or mixed with other food types. For example, vegetables mixed with rice or cheese, or salads mixed with cheese, meat, and dressing. The last thing to remember is that you won't get change back on vouchers, so make sure that your produce purchase price is as close to the voucher amount as possible. For example, if you have $15 in vouchers and your total produce comes to $14.89, you will not get back that 11 cents in change. It will be a loss. Likewise, if your produce purchase is over what you have available, you will need to pay the difference out of pocket. Now you're at the grocery store or farmer's market and you've selected your qualifying produce and are ready to check out. At checkout, it would be helpful for you to separate your prescription for healthy Oakland items from the rest of your purchase. The next step is for you to enjoy your fruits and vegetables. Then you just need to be sure to complete your health education sessions to receive your new vouchers for the next month. If you haven't already done so, please make sure to complete all of the enrollment forms located on our website. You will also need to complete our pre-program survey before you get started with us. Now I know that this is a lot of information, but if you have any questions, don't worry. You can go to contact us on our website if questions arise. As I say goodbye, I want to wish you the best of luck throughout the program. You are going to do great.
So that is the enrollment video. It is about 7 minutes long. So we can imagine that if there is no person in your site that you can dedicate to assisting clients with this enrollment process, like a medical assistant, a social worker, a client advocate, that this could be pretty timely. So, I mean, ideally, you could just give them a space, maybe an iPad or a laptop where they can watch the video on their own, and then the person can come back in and assist them with the enrollment forms. The pre-program survey is important and it is required before we send them their vouchers. But if that's something that we as a program have to follow up with the client with to make sure that they complete it, we're happy to do that. But we find the enrollment video and the forms to be really important because we want to make sure that they're fully knowledgeable about what they're signing up for before they sign up for it. So that's everything that I have as far as the enrollment. If you have questions, please drop in the chat. We're happy to answer anything or help facilitate processes for each of your sites that would be best fit to get clients enrolled in this program. Really quickly, before I finish up, I do just want to give a big shout out to our team. So they're all on the call today. So I'm just going to come over here to this page. It has been amazing working with these people. There's been a lot of work that has gone into getting us to this point. So I do just want to give them their roses. Of course, Laurel, the program lead from Oakland University, myself, Elizabeth, who is also a public health educator. We're both from Oakland County Health Division. Our two grad students, Amarachi and Aaron, and our undergrad program intern, Sophia. So thank you so much to you guys. It's been amazing working with you, and I'm so glad to see this program come to fruition.
Thank you so much, Rita, for taking us through everything. Um, and so just again, the session was recorded. So we will send that out. We can also send out the slides as a standalone to you as well in that email. And so I'd like to just open it up for questions. I did see one coming through from Marie about the pre-program survey questions. And let me just speak a little bit about that. But Rita, would you mind pulling that up and sharing your screen on the pre-program survey?
Absolutely.
So the pre-program, the program will have both a pre-program survey and a post-program survey. The survey is based on the Michigan Farmers Market Association evaluation tool that's used for prescription for health programs. And then we've also added additional questions to the survey that will look at other things around self-efficacy and knowledge, skill buildings. Part of this grant also is to be looking at reducing loneliness and feelings of social isolation. So we will have some questions in the pre-program survey about that, and then also some basic demographic questions. The pre-program survey, we have a few more tweaks to do with it. So what you see here isn't necessarily the 100% final version. We're just updating a few things.
Give me just 1 second, Laurel, because the way that the survey is set up, it's not set up for people to take it more than once. So because I already clicked in it through the website, I can't click it in again. So I have to go in through the back end.
Sure. And I think I have the same problem right now today. So the survey is through Qualtrics, and so there's some limitations around, how many times you can take it. We want to make sure that people are only taking it one time. Sorry, Carrie, did you want to jump in on that?
No, and I sent Rita this feedback, but I know we want to try to limit things on how many people take it, but if we do have seniors in the same family, in the same household that are taking it, we want to think about that limitation too. I'm just saying this because this has come up so much recently with some of our vaccine enrollment forms that we've done. So just sharing that.
Okay, I am in here, so we can quickly click through the pre-program survey. So we do ask for their name in the beginning. That name will be removed from the data when we use it for reporting purposes, but we need to know their name to make sure that they complete it and we can send them their vouchers. I can also drop this preview link into the chat, which allows you guys to just review it more in depth. Oops, that is not what I wanted.
Right. So in addition to some of the demographic questions, the health behavior questions, we're asking folks too about their fruit and vegetable consumption. We'd like to see between the pre and the post program some changes over on these. So their fruit and vegetable consumption, time spent in doing physical activity.
Laurel, you're getting a lot of feedback. You sound like you like this huge echo.
Sorry, Susanna.
So I did drop the preview link in there so that you guys can take a look at this survey more in depth, but it shouldn't take very long to complete. We put a lot of energy into making sure that it was easy to read and easy to click on. I did want to also note that all of this stuff is also formatted to be utilized from a iPad or a phone, because we do understand that a lot of clients, especially in Pontiac, may not have actual computers but have cell phones. So all of our entire program is formatted to be accessed on a phone as well.
There's a couple of questions in the chat.
Okay.
Melanie asks, will we have different language videos, closed caption for hard of hearing? Those are the first two. I'll let you guys answer those and then I'll ask the next two.
Sure. So yes, the videos will have closed captioning added to them. We are in the process of doing that. And in terms of different languages, we are currently working with Centro Multicultural La Familia to onboard another staff member who will work on putting those videos into Spanish. And then I see your next question, Melanie. How will seniors who don't understand tech use do all of this? So we do have paper surveys available. We will also have the capacity to reach out to clients via telephone. We can do a lot of these things via telephone, and our team does have experience already doing a telehealth model. And so we can do that with them as well. And then for the physical activity portion, our exercises for seniors adjusted. So when we did our previous launch of this program that was more focused on food insecurity, we have low impact physical activity exercises and materials that have already been developed. And so we'll certainly have suggested activities that are more low impact, available for folks, as needed for whatever their level of physical activity is. And so we have other materials too that we can send to folks via mail, and then things that can also be accessible via our website on physical activity.
I also wanted to note, Melanie, in regards to your question, that the physical activity portions of the program are not required. So the health education sessions are required in order to receive your vouchers, but the physical activity is not, which is why we decided to go the challenge route, because we didn't want clients to completely ignore the physical activity portion of the program. So we wanted to incentivize them to complete it. But if seniors are not able to complete any of the physical activity, it is not by any means required for them to receive the benefit of the program.
There's another question in the chat we may have answered from Susanna. Is all that filled out initially, the enrollment form? Will you be contacting them to have them fill out the survey and have them view the video? But maybe just go over that again.
So ideally, we would like that to be completed at the time of referral. We would like the whole thing to be completed at the time of referral. We understand that that could be a barrier to clinic processes. So if there's someone that you can dedicate to doing this, so say your provider says, I think this person should do the prescription for a Healthy Oakland program, they hand it to a social worker, a checkout staff, an MA, and have them assist the client in completing the enrollment process, which includes the form, the video, and the pre-programmed survey. And to Melanie's point, I think that that would help, especially for seniors or any family members who have a struggle with using technology. It helps them get over that first hump. After the enrollment, at minimum, the enrollment form is what we would need as a team to get the client enrolled. Again, the concern with only doing the enrollment form, like I'm sure many of us have experienced at a doctor's office, social service visit, or whatever, you hear about a program, they talk about it really fast, they get you to sign up, and then you go home and forget what you signed up about. So that's why we would encourage the video to be watched on the clinic site so that they know exactly what they're signing up for, and then we can follow up with them. So filling out the enrollment form for us means that we know that the clinic site informed them fully about what they're participating in, and then we can follow up with them. If we get an enrollment form and we don't get a pre-program survey, our program staff can follow up and again reintroduce the program to the client, and then encourage them to complete that pre-program survey so that we can send them out their first set of vouchers.
Thank you. We plan to do all of that at the Bernstein Clinic, but I just didn't want to have a freak out moment if somebody slipped through the cracks, as long as they had filled out that form. So thank you. Could we get the paper copy for anybody that might need that?
Sure.
Who doesn't have access to technology?
Sure. Absolutely. So I don't see any other questions in the chat after that. Is there anything else information-wise we can provide to you? We will send out the recording via email after we get it all uploaded and everything. And you please always reach out to me if there's anything that you need, any questions that arise. We as a team are very open. We have the Prescription for Healthy Oakland email address and phone number. That phone number pings directly to my phone. Don't tell clients that. If they need it, they can use it, but it pings directly to my phone. And I'm always happy to answer any questions that may arise as you're starting to integrate this program into your respective sites. Laurel, did you want to close it?
I'm sorry, Rita, I accidentally muted you. My apologies.
Okay.
Yes, does anyone else have any other questions? All right, so we'll follow.
There was another question from Deb in the chat.
Yeah, we have another question. Deborah is asking us, looks good question. Are we targeting?
Hi, Rita. I'm sorry. Somehow you got muted.
I'll read it out loud. From Deborah, looks good question. We are targeting low income families and providing a voucher. We encourage to eat fruit and vegetables with voucher of $80 or $40. But what happens afterward when no more money?
So each person is enrolled in the program for 6 months. The hope is eventually we are working on program sustainability. Part of the reason that we got this grant was to build a body of evidence to show that these types of programs work. And so there's lots of different programs across the state that are doing this. And this is partially why we are in line with Michigan, the Michigan Farmers Market Association. And we're trying to share data across the state to build this body of evidence so that these types of programs can be integrated at county levels. So they run all the time, something like SNAP benefits or WIC benefits. And so that is the end goal of all of these types of prescription for health or produce prescription programs. And so for this program, right, this was originally only a 2-year grant, which got extended to 3 years for COVID. And so again, our hope is to run a successful program, show that it does increase fruit and vegetable consumption, which in the long term, the idea would be that that would reduce risk of chronic disease, long-term, and lower healthcare costs. And this is a really good incentive to bring on different health systems to support these kinds of programs, counties, state, federal agencies to support these kind of programs. So unfortunately for our specific program, after the 6 months for that participant, that will end. It'll be the end. But again, the end goal is to really integrate this and build it across the state. And Carrie, did you want to add to that?
Yeah, and I think also, Rita and Elizabeth and the lovely grad assistants that we have from OU are going to be doing kind of some case management with all of the clients too. So if there are other food assistance, if they're food insecure and there are other food assistance benefits that they are not currently utilizing, they will kind of help educate them about that, get them connected to them, make sure they know about things like double up food bucks if they're on SNAP and where they can, use that program so they're stretching other benefits that they might have more. So I don't think this program is, it's supplemental, just like if you were on WIC or something else too. So we know that there are a lot of people struggling out there even more right now with being food insecure. So we're going to make sure we're able to connect them to any other benefits that might help them in their food security and healthy eating goals.
Absolutely.
Yep. Yeah, thanks, Carrie. And so on the website, there are other resources with links to those programs. And then we also have health education sessions that do address some of those other benefits that we can connect our clients to.
So a few things that I wanted to bring up that just spurred from that. Melanie, you asked about any challenges that were for seniors, or just any person that might have any other barriers. On the enrollment form, it does ask if there are any barriers to you for shopping in the store. And if somebody, I think I'm about to answer this question that just popped up in the chat. If somebody has challenges that we can't help them figure out how to mitigate on their own, we do have a process that we have reserved for people, and a partnership with Sprout, so that they will provide produce bags that they will prepare, and the client can come and just do like a curbside pickup. If they are absolutely not able to come do a curbside pickup and it isn't just the shopping in the store, we are going to work to get those items dropped off to them. Now, that is something that we are not necessarily advertising, because it's a challenge of our program staff to be able to coordinate dropping all of that off. But we do want to have it as a resource. If our program specialists have conversations and identify that they can't overcome what they have identified as barriers, we will offer that to them. And there was something.
There's a question from before that Susanna was asking about. Will you be sending a flyer for the program to us? We were thinking of attaching vouchers to our prescription bags when folks come in for refills.
Yes. So the flyers, we do have info cards that are being printed, and we will drop them off to your respective sites. So we'll be communicating with you individually on the best way to get those to you. And as far as attaching the vouchers to your prescription bags, our staff will send out vouchers. The referral site doesn't have to have any responsibility in voucher management. There's quite a bit of tracking that goes into the vouchers. So we will get those directly to the client. We'll send them out in the mail. And we've also discussed potentially having a pickup site if there's some issue with getting them in the mail, but fingers crossed we won't have any issues with that.
And then Monica just mentioned to be aware, and I think this was touched on, that CSFP through OLSHA and Meetup and EAT-UP are programs that are free and supplemental as well. To add to, I think, what you had said.
Yes, just so when you're telling people about other resources, those CSFP is for seniors. We also have TFAP, but if you visit a food pantry, you're probably participating in it and you just don't even know.
Awesome. Thank you, Monica.
You're welcome.
So lastly, again, we have communicated that April 1st will be our launch date. If you have clients that you are starting to identify, slowly send them to us. We'll get them started. This will kind of be, April is kind of going to be our work out the kinks month, so that we can see how this is going for you guys as far as referring, and for our program to just see how things go when we start, because this again was done from scratch. So we're just going to work collaboratively. Is that a word? Did I just make that up? Together to see how this goes. And if, things need to happen, we'll pivot. And we're here to support you guys as client referral sites in our program. So thanks again for joining us. If there are no more questions.
Great. Thank you, Rita, for taking us through things. Folks, we are around, so feel free to reach out with other questions, and you will be hearing from us shortly with the recording and slides and other check-ins and material drop-off. So you all have a great weekend. Thank you so much for your time.
Bye.